Hey, my name's Hannah. Welcome to my presentation on myocardial infarction, also known as a heart attack. This is an acute, sometimes fatal condition. It is reported by the New York State Department of Health that about 805,000 Americans have a heart attack every single year. Of all of those heart attacks, 605,000 are first-time heart attack, and about 200,000 happen in people who have already had a heart attack. So this can be a recurring thing. So let's first get into the cardiovascular system. The primary function of the system is to pump blood and oxygen throughout your body. The two main components are your heart, which is a muscular pump. It generates the force to transport blood all over your body, and the blood vessels. There are arteries that transport blood away from the heart, capillaries that transport blood between the arteries and the veins, and veins that transport blood to the heart. Arterioles are little segments between arteries and capillaries, and venules are little segments between capillaries and veins. And then there are two closed systems. The pulmonary system works between your heart and the lungs, and the systemic circuit is through the rest of the body. And then here is the heart. It is built up of four chambers. Atria, they receive blood from the body, and ventricles pump out blood. There are two atria, the left atrium and the right atrium, and there are two ventricles, the left ventricle and the right ventricle. There are four valves. The job of these valves is to make sure there's no backflow of blood while the heart pumps. So there are valves between each atria and ventricle. The bicuspid or mitral valve is between the left ones, and the tricuspid valve is between the right ones. Pulmonary valve is between right ventricle and pulmonary artery. Aortic valve is between left ventricle and aortic artery. Aorta is the first artery that pumps blood throughout the system, and then the superior and inferior vena cava bring blood from the body to the right atrium. And kind of the main component here are the pulmonary veins and arteries. Now, this is kind of the primary, I guess, the most affected area when a heart attack occurs, because their role is to pump oxygen through the tissues of the heart and blood. So a heart attack can occur. Here's another image of a heart. A heart attack occurs when those usually become compromised. Here's an image with all the other features of the heart, just to further your understanding of the anatomy of the heart. So a heart attack is a disruption of blood flow through heart tissues. The primary cause of this disruption of blood flow is coronary artery disease. This is caused by atherosclerosis, which is a buildup of plaque in your arteries. This image here shows plaque kind of built up along the artery wall. And what happens here is it becomes so thin that the blood kind of starts to clump, and that causes the blood clot. So a heart attack happens when this occurs and the heart muscle starts to die because it's not being it's not receiving blood and oxygen and everything. So that will not be great. Signs and symptoms of a heart attack. You will experience angina, which is pain, tightness in the chest. You'll also experience that pain and tightness in your shoulder, jaw, and neck. You may feel cold sweat, fatigue, heartburn, shortness of breath, dizziness, nausea, and lightheadedness. Now, symptoms of a heart attack may present differently in males and females. Usually, women experience more flu-like symptoms, whereas males feel more of that chest pain. Not to say that you might not experience all of these, but it's just some common risk factors are listed here. We've got age, usually above the age of 45 increases your risk. Tobacco use, drug use, not included here, caffeine use can cause a heart attack. Chronic high blood pressure, stress, cholesterol, high triglycerides, obesity, diabetes, diet. If you are eating a high-fat, high cholesterol diet, that could put some harm on your arteries. Family history, lack of exercise, and having a pre-existing condition may increase your risk. Now, in order to diagnose, you have to be tested. If you're experiencing the symptoms, go see a professional ASAP. An EKG monitors the electric flow through your heart. So they'll attach stickers onto you and print out a sheet of your heart rhythm on it. And they're able to figure out if you've had a heart attack through that. Blood tests, they're looking for troponin. Now, troponin is a protein within heart muscles. When that heart muscle becomes damaged, it will release that troponin into the blood, elevating the levels. So when they're looking for a heart attack, they're looking for that heightened level of troponin. Cardiac catheterization is when they insert a catheter, usually through the wrist or the groin, that injects dye into your coronary arteries and veins to highlight them when they take an image. X-rays, echocardiograms, CTs, and MRIs are other diagnostic tests that they may run to identify if you've had a heart attack. Here is an image of a normal EKG and a heart attack EKG. You can see the normal one is a pretty consistent sinus rhythm. The heart attack, you can see that's more inconsistent and random. So that shows the discrepancy in the electric flow through the heart. Treatments. You may be prescribed medications. Aspirin is good for reducing blood clots. You may be prescribed a clot buster, and that job is to destroy clots before they cause a blockage. You may be prescribed nitroglycerin, and what that does is it expands your blood vessels, makes them a little bit larger for your blood flow. Surgical procedures include a cardiac catheterization. Now, back to that cath, it is a diagnostic tool, and it is also used during procedures. They may insert a stent, which is like a film like tube, and they'll place that in your artery to expand it. They may also do a coronary artery bypass graft, also known as a CABG. That procedure takes an artery or another vein from your body, and what that does is they attach it above and below the blockage to create like an alternate road to go through. Cardiac rehabilitation. This will be a personalized kind of treatment plan where you go, you start exercising. They help you manage stress. They help you create a good diet. They basically get you back and slowly reintegrate you back into your normal life with healthier lifestyle kind of skills post heart attack. Some long-term conditions, you may develop an arrhythmia. Now, this is an atypical um, heart rhythm, and this can occur due to um, affected electric signals through your heart. So if your heart tissues are damaged, that could inhibit the electrical signals from working the way they're supposed to, and your heart will beat irregularly. Pericarditis is when the pericardium becomes inflamed and it swells up, and that can be an after effect of a heart attack. Now, cardiac arrest may also happen. This is a very severe, usually fatal situation where the heart just stops functioning and stops beating. It's intense, so that can also be a long-term post effect. Just wrap up. Heart attack is caused by reduced blood flow to the heart tissues. There are risk factors, including but not limited to age, weight, diet, existing conditions, lack of exercise, and family history. Signs and symptoms include but not are not limited to angina, nausea, indigestion, shortness of breath. A medical professional has to diagnose you with a heart attack, so they'll run EKGs, they'll do scans, they'll do blood work. There are many treatment plans, medication, surgery, and rehabilitation. There are some post heart attack complications like arrhythmias, heart failure, pericarditis, cardiac arrest, and prevention is lifestyle changes. Get your exercise and get your steps in, eat good food, take good care of your body. And that is it. Thank you so much for watching. Have a great day.